Well, this morning we're learning new information about how our bodies work that could get to the bottom of some health questions you may have. Today we're joined by our WWL TV medical correspondent, Dr. Corey Hebert. You're going to tell us about body pain, how that can be linked to your feet. But first, not brushing your teeth while being treated in the hospital can lead to pneumonia?
Yeah, well, first of all, I just want to let everybody know, I need you to brush your teeth. Okay.
Whether you're in the hospital or not.
Some people have not changed their toothbrush since they were watching, American Bandstand with Dick Clark.
Oh.
Okay.
Huh.
And that's gross.
That is...
I need you to do that. You need to change your toothbrush every 3 to 4 months. So just go home and throw it out. But what the study actually showed is that this non-ventilator hospital-acquired pneumonia, okay, there's a 30% fatality rate if you get this. That means you're in the hospital, and you're not on a ventilator, but you can't really breathe very well, okay, for lack of a better term. So basically what happens is they are not getting their teeth brushed because they put it out lower on the totem pole that you don't really need to get your teeth brushed as much as you need some other hygiene things, right? But the problem is that that slime that builds up in your mouth actually goes into your lungs and causes, and that's called aspiration, okay? And then that gets in your lungs and causes you to have pneumonia. This is a really, really big deal. And so they by brushing the teeth of the patients, they, in some studies, have decreased this pneumonia by 92% in the hospital. This is a very serious thing. I mean, if you or I get pneumonia out there and you're young, it's called walking pneumonia or whatever, community-acquired pneumonia, it's not going to be that big of a deal. But if you're in the hospital, I mean, that's a hospital-acquired pneumonia, and people die from this. So if you have a family member and they're in the hospital, please make sure that you brush their teeth or that they get their teeth brushed. It's very, very important. And please, just floss too.
Yeah.
Floss, brush. It's good for your health.
That's very interesting.
And for the health of the people around you, if you know what I mean.
Yeah, yeah. Okay, so if you have back pain, hip pain, knee pain, it could actually stem from your feet.
Yes, yes. Now, I've been seeing a lot of patients coming in to ERs and to my clinic where they're saying their feet hurt, but then they say their ankles hurt or their knees hurt or their hips hurt. If you have flat feet, you need to make sure that you get some orthotics, or you need to have some insoles in your shoes, because the arches in your feet affect all parts of your body. And so if you have the angles between your ankles and your knees and your hips are very, very finite, meaning that you need to have them in a very specific position so that you don't have a leaning of your spine, okay, or tilting of your hips. And if you don't have that, that straightening, then you're going to have pain. And I need you to recognize that if you have this, if you have flat feet, I want you to look in the mirror this morning. If your feet turn in, meaning that your knees kind of lean in and your arches, which are the underside of the inside of your feet, touch the ground, that is going to be a problem. As a matter of fact, back in the day, if you were in the military, they wouldn't even really let you march, and they probably wouldn't even let you in the military, because if you have this, you can't, if you walk long periods of time, you won't be able to, you have a lot of pain. And so that was an exclusion to be in the Army. So please, and also if you have a very, very high arch, that also can be pain. So go to one of these stores where you can step on this machine and they'll see what your feet look like. And if you're having back pain or knee pain, hip pain, go do this immediately, because that is such an easy fix. You can get this fixed almost immediately.
I know sometimes people are like, oh, those insoles are so expensive. Anything's worth not having back pain.
That's right. And I've always said to folks, please, your feet are very important. You don't realize how much you need them.
Okay.
Until you don't have them.
Until you don't have them. All right, we only have a minute left.
All right.
People are always talking about, oh, I got to get my steps in, in. How many steps does it take to actually lose?
To Tootsie Roll, or Tootsie Pop. Okay.
To lose some weight.
Yeah, we need you to get 10,000 steps. Actually, 9,800. All right, I know it's kind of specific, but we need you to get 10,000 around. But the problem is, what I see is when I'm walking around the city, I see people trying to get their steps in. They're sauntering around with the cocktail, drinking a smoothie, talking to their friends, trying to get their 10,000 steps. That doesn't work. 3,500 of those steps need to be intense. You need to be like in a boot camp. You can't just be trickling around a track thinking you're going to get something done. I need you to really get some sweat in this walking. You can't just walk, right? All right, so, and let me tell you something. The more steps, the better.
Thanks for bursting my bubble.
Look, with the right insoles, your feet are important. get the steps, but get it done right.
All right, stay away from the Tootsie Pop too if you're trying to lose weight.
There's 3,722 licks. That's what it takes. I did it in college.
Dr. Hebert visits every Tuesday on the Eyewitness Morning News. If you missed his previous updates, you can get his expert opinion and humor on our app, YouTube page, and website, WWL TV.